Babette, Simon, good afternoon.
Very warm welcome to all of you also for my side. Thank you for the introduction.
Un mot peut-être pour vous présenter. Babette, vous êtes professeure associée à la faculté de santé.
You're an associate professor at the University of Paris. You're a member of the expert group within the forum, and you dedicate your work to developing new ideas within health research. So the idea is how to care for EU citizens, how to diagnose everything. So which resources exist in the member states and which EU capacities need to be reinforced?
I think the world was not prepared for this COVID pandemic. And actually, it's very important to realize that it's not only COVID-19, which is a challenge of the 21st century, but we are currently facing the climate crisis, loss of biodiversity, environment pollution all over, new zoonotic diseases, and a dynamic rise of non-communicable diseases, and so on. But the corona crisis showed us how vulnerable we are, how vulnerable our planet is. And it has painfully illustrated how environmental, animal, and human health and well-being are, and also security and economy around the world, are intimately interconnected. And we have learned that we need to think health globally, and that health must be perceived in a One Health approach. We do have only one health on that planet. But so far, there is no coherent health strategy. Internationally, and the European arrangements appear more fragmented, weak, inadequate in scope and strength to deal with the health challenges we are talking here about in the 21st century. And today, the next speakers now from table one will give some impressions how important an united action for more robust health architecture will be. And we need to innovate and strengthen our health agenda, and we should come to a lived European Health Union. And that would also allow to address our challenges together in a spirit of global solidarity and cooperation. Now we will hear next the voices and positions from diverse professional organizations in Europe and representatives of civil society, as well as two young generation voices, which is very important. And this session will introduce the One Health concept, give impression of environmental changes, address chronic as well as rare diseases that pose manifold challenges, and illustrate the impact of philanthropy in environmental research. So.
On comprend en vous entendant, Babette Simon, l'importance d'aller vers cette approche de la santé, de une seule santé.
Indeed, we understand the importance to have a global health approach. So we'll ask our first speaker, Amanda Fine. She's the Director of Wildlife Conservation Society. She is going to share her thoughts with regards to One Health. She is currently working on interconnected topics. Amanda, please.
Thank you very much. It is my honor to be here and participating in Table 1 and highlighting what I see as a critical need of our times, which is to promote health and health for all as a central and very central to our collective goals. I advocate here for a One Health approach, which encompasses the health of individuals, communities, and our planet, recognizing these intrinsic and inseparable relationships between human health, animal and plant health, and our environment. A One Sustainable Health approach acknowledges these connections across the health sectors and recognizes the need to address the pressure from our collective human behaviors on ecosystems, including pollution, the heating of our planet, and the unsustainable exploitation of natural resources, which is leading to deforestation, exacerbating climate change, but also facilitating wildlife trade and accelerating biodiversity loss. Europe has the opportunity to really lead the world in our work to reverse these trends through this focus on health, through a consistent and holistic approach across all regions, regardless of wealth, specific interests, and cultural differences. This is similar to looking at health in the context of the UN Sustainable Development Goals, knowing that health is dependent on achieving the SDGs related, for example, to life on land and life and clean water and sanitation, but it is also central to achieving many of the goals, for example, no poverty, zero hunger, and sustainable cities and communities. Next slide, please. Here I provide an example of the effectiveness of utilizing a One Sustainable Health approach to address the COVID-19 pandemic in Vietnam. In the early days of the pandemic, WCS was involved in establishing a pandemic prevention task force in Vietnam with participation from the UN agencies led by FAO and WHO, the development partners, embassies of governments, including France, Germany, Australia, the US, and the UK. Together with a conservation community, we joined up to provide a shared message with one voice and multi-sectoral support to the government of Vietnam in responding to COVID-19 and in preventing the next pandemic, with a focus on addressing the health risks associated with the commercial trade in wildlife. The multilateral response to this issue, again speaking with one voice, was acknowledged by the Vietnamese government with an invitation to meet with the Prime Minister of Vietnam, coincidentally exactly 1 year ago today, and to talk specifically about pandemic prevention by managing the human-animal ecosystem interface. The ambassador of the EU officially represented all member states, and the group expanded on both the equitable and transparent provision of vaccines in Vietnam in the face of the current COVID-19 pandemic, and the commitment to address wildlife trafficking and the unregulated trade in wildlife, which is a critical threat to biodiversity in Vietnam and the region, as well as one of the key drivers of the emergence of pathogens with pandemic potential. So this brings me to my recommendations, also encouraging Europe to play a leading role in establishing a framework convention, a treaty on pandemic prevention, preparedness, and response, bringing countries together around a single goal. Utilizing this One Sustainable Health principles, there's an opportunity to build on declarations and really move beyond the voluntary guidelines to what is much needed action that will both encourage and really inspire real change. The Vietnam example illustrates the potential of this concept, focusing on co-benefits for human health and the environment, and incorporating aspects of Europe's Green Deal into securing our global health. I also recommend strengthening mechanisms for rapid generation of accurate and trusted information, as has been mentioned by other speakers, through data sharing, targeted surveillance, and allowing adaptation to changing health needs and research questions. And finally, recommend sustaining investments in the workforce across all health sectors, from those frontline personnel stopping the spread of infectious disease in communities, to those frontline park rangers protecting our wildlife and watersheds and ensuring that ecosystems are functional and resilient. So please capitalize on this opportunity to listen to community voices advocating for One Health and realize the co-benefits for the health of people, animals, plants, and the environment. Thank you very much.
Un message fort, Amanda Fine. Merci, Babette Simon. Le prochain speaker de cette table ronde, c'est Susana Lopez-CHARRETON.
Oui, as I said before, environmental changes have major impact for human health. And Suzanne Lopez, as well as Benjamin Roche, who comes after her, they will give us impression about zoonotic diseases, emergence all over the world. And Susana Lopez is a virologist at the National Autonomous University of Mexico, the UNAM, and co-head of the virology lab at the Biotech Institute.
Hello, good morning. Thank you for this invitation. Can you hear me?
Nous vous entendons très bien, Susana.
Okay, thank you very much. As you know, during the last decades, we have seen an increasing number of pathogen emergencies through the world, and most of them are zoonoses. We also know that if we continue business as usual, more viral outbreaks will occur. Therefore, we need to be better prepared and develop prevention strategies. Mexico has been dramatically affected by such emergencies, with a very big high burden due to the COVID-19 pandemic these last 2 years, the Zika national spread in 2016, and of course, the emergency of the H1N1 pandemic in 2009. To fight these threats, the scientific community of Mexico is being supported by the funding agency CONACYT, which has launched a national strategic research program in virology with the aim to foster the development of virology in Mexico based on state-of-the-art multi and cross-disciplinary research, support the formation of specialized human resources in virology, and to promote translational research to help in the solution of endemic and emergent health problems in the country, in close collaboration with the government, social and industrial sectors. This program also aims to support the creation of a virology research center in our country, which we don't have, increase the understanding of clinical and epidemiological factors of viruses associated with regional health problems, characterize the basic aspects of evolution, biology, and pathology of relevant national regional viruses, and characterize the impact of biological diversity, vectors and reservoirs, and socioeconomic ecosystems in emerging viral diseases. Therefore, we think that Mexico is playing a pivotal role in the preparedness and prevention programs in Latin America. Now, the objective today is to articulate this national effort with international programs in order to create scientific and operational synergies at the largest scale possible. Thank you. Benjamin?
Yes. Thank you,
Merci,
Susana.
Susana. Nous allons maintenant entendre Babette Simon, Benjamin Roche.
Babette will now yield the floor to Benjamin Roche.
Research Director at the French National Research Institute for Sustainable Development in Montpellier, and co-director of the International Lab El Dorado and member of the PREZODE Preparatory Committee. It's all yours.
Thank you, Babette. Bonjour à tous. Donc oui, effectivement, comme l'exemple du Mexique vient de...
Indeed, great example in Mexico. We have a great mission for European Health Union, the objective of synergy at the local and international global. So we started with an international lab, and that's a French, Mexico, and American project. And it is part of the PREZODE initiative that aims at catalyzing the international efforts. So, PREZODE, that was launched over a year ago by the French president, includes over 100 partners. And we have two priorities. One is to improve the One Health surveillance networks in order to detect earlier the illnesses that could jump from animals to man, and to protect the ecosystems so that they become resilient to those. So we have to produce scientific evidence, and we need to co-build different solutions with the different actors. In this context, and in order to be more efficient, we have two roles to play. We need to engage the actors from all sectors to envision sustainable prevention strategies. We need to act at all levels of society to make sure there is no fracturing and develop strong and equitable health systems that integrate the need for interdisciplinary, cross-sectoral and cross-country collaboration. And nobody can live outside a pandemic, so those efforts should be global. Secondly, we should develop integrative prevention strategies relying on scientific knowledge, especially framework for pandemic preparedness and response in a rigorous way. Because we're talking about global efforts, they should be coordinated, and therefore we need to increase public investment in inclusive prevention, not only for zoonoses, and we should work with regards to preparedness and response. When we invest in prevention, that could cost less than 1% of the cost of dealing with the pandemic. Today, we cannot afford to have a pandemic every year, which is exactly what is going to happen if we don't act and if we don't think and act differently. Thank you. Okay, thank you, Benjamin Roche. That's the importance of investing in co-build and think differently. Let's switch to Isabel Giordano. She's the new General Director of BNP Paribas Foundation.
She will explain the link between health and environment and how philanthropy can play an essential role in One Health issues.
Hello, everybody. I hope you can hear me well.
Nous vous entendons très bien, Isabelle. Bonjour.
Bonjour. I will say a few words in English. First of all, I would like to start with a question. What does a leading bank has to do with health proposition today? And in fact, why a bank is involved in research? It's very important for me to start with telling you that as one of the oldest and largest foundation in Europe, BNP Paribas has a real social responsibility. So what does it mean concretely? Our aim is to have a positive impact on society. We want to contribute on social and environmental change. So this is the reason why the foundation has decided 10 years ago to choose science research and to support the research, to support climate change, biodiversity, and more recently, a specific program on the direct impacts of climate change on health. So indeed, there is a link between environment, biodiversity, and health, and between the three ecosystems. We support, for instance, researchers who are working on zoonoses, the relationships between animals and humans, evolution of trees, melting of the glacier. So this is just examples. It is very essential for us to contribute to protecting the Earth ecosystem and, of course, the health program. And we have all seen during the pandemic how the philanthropy was helpful and the very crucial role of philanthropy. So personally, I do think that philanthropy is a kind of accelerator for social transition and for health progress. So on the second slide, you will see what do we do with the BNP Foundation. We finance research projects in order to increase knowledge and awareness on climate and biodiversity. For the last 11 years, we have supported 27 international researchers for a budget of 18 million euros. We launched recently a partnership with the FRM, the Foundation for Medical Research, for 1 million euros. And for instance, we have started a study on children allergy. This year, in 2022, we are launching our 5th call for project called Climate and Biodiversity Initiative. It's a 3-year program aiming to increase the understanding of interaction between environment and, among other, health. If there is one message for me today, is my main message would be that I wish we have more and more contributors for research. We have more private sector involved in financing and supporting the research. So this is what I wish after this panel, after this One Health Summit. I wish we will be more and more foundation to support the research and health. Thank you.
Merci Isabelle Giordano, et on comprend bien le rôle que vous avez décrit des fondations dans la recherche et le financement.
Thank you, Isabelle Giordano, for explaining the role of foundations and their impact on different studies. Let's switch to Antoine Lau.
Antoine Lau, he is professor and director of the Institute of Global Health at the University of Geneva, and he is a medical epidemiologist, and he will focus on pollution, and in particular
il va mettre l'accent sur la pollution et sur la pollution de l'air ambiant. Je suis désolé de n'avoir pas pu me joindre à vous aujourd'hui, mais je suis très heureux que vous m'ayez donné la possibilité de réagir sur l'interaction entre la santé humaine, animale et environnementale. Cette pandémie a révélé cette interaction qui n'a pas été prise en compte de manière appropriée. Si l'Europe peut être le moteur de recherche et alimenter la réflexion et la recherche, ce serait très bien. Donc, rapidement, concentrons-nous sur notre travail à venir, notamment l'amélioration de la qualité de l'air à l'intérieur. Nous passons 90% de notre vie à l'intérieur, dans des locaux mal ventilés, bondés, que ce soit des bars, restaurants, des logements, les transports comme les TGV où les fenêtres ne s'ouvrent pas, les écoles, les bureaux. Et 99% des contaminations au SARS-CoV viennent de ces situations. Uniquement car ces lieux sont mal ventilés, avec une mauvaise qualité de l'air, qui évidemment est inférieure à la qualité de l'air extérieur. Nous essayons de
as a high level of air quality which is outdoor, we will succeed maybe to cut by 99% the contamination by SARS-CoV-2. Is it the end of this pandemic? I don't know. I'm really not sure. We cannot predict that. If it will last for years, with this kind of new variants or new emerging strain or even influenza viruses or other coronaviruses, that will be a nightmare. We cannot lock down our lives and our societies like we have done in the past. We need really to implement such a big program. That is the kind of measures we have to implement, either in emergency with some, I would say, not bricolage, but some means which may ensure you an appropriate air quality, and with a big project initiative which will transform dramatically the way our houses and our buildings are built. Thank you for your attention. I apologize not being
Merci
able to...
Antoine Flao, la vidéo est en train de repartir. Je crois que nous avons bien compris son message, qui est un message assez étonnant.
Yes, so well, the video is actually running again, but I mean, we all understood the importance of air quality. And Babette, the next speaker is Yann Lecam.
Lecam. He is co-founder and chief executive officer of the IRD-PREZODE Foundation, Rare Diseases Europe. And he will give us his perspective of key challenges. It's your floor.
Thank you, Babette. Indeed, one area of high community added value is to address the challenges of 30 million persons affected by one of the 6,000 low prevalence and complex diseases in Europe. It's indeed a major area of collaboration between researchers, clinicians, and all stakeholders to address the challenges of rarity. And in fact, without a European or a global action, we will still be completely ignored and in the dark. And this has been recently recognized by a UN resolution on addressing the challenges of rare diseases adopted in December. What we are promoting is a holistic approach. Rare disease, in fact, have become pioneers in tomorrow transformation and creative solutions for research and healthcare, an approach to design and implement programs, policies, legislations, and research across multiple sectors in order to communicate and work together to achieve better health and social outcomes. And in fact, our community has progressively incarnated this One Health approach with innovative models of care and innovation created at the margin of the healthcare systems and of the research systems, which now can benefit to all. So with this experience, we're now promoting a European model of care, because we think there is a specific European model which is inspiring the rest of the world, at least in the field of rare diseases, for sure. And also to promote an ambition for Europe to be a world leader in research and innovation. I can see that, I'm not sure that my slides are put up, but that's why I can continue.
Les slides ne fonctionnent pas, effectivement.
Okay, that's all right.
Plusieurs à vous demander où sont vos
fine, no
slides.
problem. So our recommendation is in fact to develop and adopt before the end of 2023 Europe's action plan for rare disease. And this proposal is based on a comprehensive foresight study conducted in the last 2 years, initiated by the European Parliament, funded by the Commission, to which 200 experts participated with a robust methodology. There was also a young citizen panel, and there has been surveys with thousands of citizens participating. And this recommendation for Europe's action plan really on rare disease illustrates a common ambition for a strong European health union and some of the recommendations that we have in the One Sustainable Health. For instance, that we're calling for a cohesive, transversal, cross-sectorial policy of actions, because one of the major problems we faced with is a siloed approach, which is highly ineffective because we're looking things separated from other policy areas. We cannot solve the health issue without looking at research, industry, social, different elements to be integrated. The second is that we need to innovate on how to connect European experts, knowledge and data in order to have a more knowledge-based healthcare system delivering better on health outcomes and aiming to have a better equity. The third is an ecosystem between research and innovation so that Europe can be that world leader in innovation and research. And next is to integrate much more the strategies from the national level. That's the only way to overcome rarity. It just makes sense. But this can be done only in one policy framework, which is not only in health, but again, cohesive across the different sectors. And last is to have a plan which is aligned with the Sustainable Development Goals and in fact, contributes to specific Sustainable Development Goals, such as the one on health, the one on poverty, the one on innovation and research, or the one on partnership. And to conclude, I would say that based on our experience in the field of rare disease in the last 20 years, particularly the last 10, and with this work to look toward 2030 and 40, we believe that Europe can have a stronger role to address the needs of its citizens, that it's meaningful for them, and to have specific plans in the area of cancer, of rare disease, of antibiotic resistance. So where there is a high community added value, but within a larger one sustainable health policy framework, which would deliver then social, health, economic and policy outcome for its citizens and perceived by them. Thank you.
Merci Yann Lecam, et nous allons continuer à parler de maladies rares avec
Thank you. Let's move on to Sandra Vukusic.
She is professor of neurology at Lyon University Hospital, president of the Edwige Foundation against multiple sclerosis, and scientific coordinator of the French multiple sclerosis registry. And she will give us impressive information about multiple sclerosis as a chronic disease and the challenges and the needs and the recommendations.
Thank you very much. Thank you very much, Babette, for your nice introduction, and welcome to everybody. I'm very happy to host you here in our nice city of Lyon. So the Edwige Foundation is fighting against multiple sclerosis, mainly by promoting the use of MS registries to improve our knowledge about this debilitating disease and contribute to a better patient information and quality of life. My presentation will illustrate how Europe can be a major player in this field, but also how many difficulties we have to face in practice. For that purpose, I will present the example of a project currently supported by the foundation called Coupez. So multiple sclerosis is a chronic, both inflammatory and degenerative disease of the central nervous system, first cause of non-traumatic disability in young adults. In fact, it is not a rare disease, that it affects 700,000 persons in Europe. MS has a limited impact on life expectancy, and the prevalence of comorbidities is high and increases with age, generating highly complex chronic conditions. As you can see on these figures, comorbidities adversely influence MS disease course and modify the use of healthcare resources, including underexposure to preventive care and cancer screening. Comorbidities also adversely affect treatment decision in MS and modify treatment effectiveness and safety. And the reverse is also true. Next slide, please. To describe the complex interactions between MS and several comorbidities, a group of European MS registries associated since many years in big MS data proposes to link the national disease registries to medico-administrative databases. All data on MS are present in MS registry in a harmonized way. Medico-administrative database would be useful to detect comorbidities and their treatment, but there is a huge heterogeneity in their content, in the algorithms to detect comorbidities in those databases, in the linkage abilities across countries, with a lot of administrative issues. We also had to think about how to share cross-national data, as there is currently no IT facility in Europe. We also had to build a consortium of experts, from neurologists to biostatisticians, specialists in artificial intelligence and in analysis of health resources. Next slide. So what do we really need? We need strong cross-national collaboration to foster the research on chronic disease in Europe. And the Coupez example in MS can be used for many other chronic or rare diseases. We really need to facilitate the use of the huge amount of existing data by defining common minimum standards, by defining common quality standards, promoting interoperability between different sources of data, overcoming complex legal and administrative issues to access and share data, developing high-level standards for analyzing data, including artificial intelligence. We need to promote the use of already available real-world data to inform the post-marketing surveillance of new drugs in partnership with industrials and regulators. In that perspective, building a European health data hub, but also European Research Institute dedicated to such chronic disease, could place Europe in a top position. Finally, I would like to say a more general word as a clinician on the importance of thinking globally about health issues and not only disease by disease. A person with MS, a person with a chronic or rare disease, a person with any kind of disability should have an equal access to healthcare resources and should benefit from the same preventive and screening activities as the rest of European people. Thank you very much for your attention.
Thank you, Sandra Vukuzik. On comprend là l'importance d'une base de données commune pour partager.
Indeed, we understand the necessity to have a global data bank. As I said in our introduction, it is important to listen to the voice of students. We are going to listen to two students, Francesco.
You to listen to two young voices which represent the young generation, and we are very happy that you are with us. Francesco.
Welcome.
Francesco is a veterinary doctor and is currently training at the École nationale des services vétérinaires, France Vétérinaire Internationale et Vet Agro Sup, as a trainee in public health. So the floor is yours. You can take the other one too. That's yours.
Bonjour à tous. Je vous remercie de me donner l'opportunité.
Thank you very much for the opportunity to mention two challenges that are important to my mind. First of all, to guarantee a sustainable food system. I have the following recommendations: change the World Trade Organization agreement so that all countries respect the same rules. Secondly, improve the information on labels so that the consumers understand the origin and the modality of production. And thirdly, favor a short circuit at the European level. Secondly, Europe must make sure that humans, animals, and ecosystems remain healthy, especially with the fight against zoonosis illnesses. I suggest the following three recommendations: prevent and manage infectious diseases in collaboration with the World Organization of Animal Health and the WHO. Secondly, remember how we worked on past crises in order to be more reactive in forthcoming crisis. And thirdly, set up a common training for all European health providers. And this must be decided by decision makers who must become aware of those challenges. If we do that, Europe will show how efficient it can be. Thank you for your recommendations and for your direct and very clear recommendations, Francesco Lupasella. We now have Laura Roth from the Technical University in Munich.
Invite Laura Roth. She is science manager and project coordinator at the Center for Global Health at the Technical University of Munich, with a background in economics and global health. And she will give us her perspective on the interplay of climate change, One Health, and time. It's your floor.
Yeah, thank you very much, Babette, for the kind introductory words, and thank you for the opportunity to speak at today's conference. When it comes to caring for the health of EU citizens and their environment, climate change as the most important cross-cutting global issue of the 21st century and its intersection with One Health and time should not be absent from any discussion. The impact of climate change cannot be emphasized enough, as can the speed at which climate change is accelerating and biological diversity is decreasing. Animal welfare and environmental health are at stake, and humans who are fundamentally dependent on the environment are facing a range of global health threats, ranging from infectious diseases to antibiotic resistance and non-communicable diseases. Therefore, climate change must be considered one of the most significant challenges for achieving the Sustainable Development Goals, and thus also for the goal of protecting and strengthening the health of EU citizens. The topic is well known in public debate, even if it's still not addressed with the necessary urgency. However, despite the political and scientific will manifested in international agreements, such as the hitherto unfulfilled promises of the Paris Agreement, the current indicators tracked by the Lancet Countdown show that recent decarbonization promises are inadequate to cope with deteriorating climate conditions.
Merci. Laura, yes,
yeah,
you have
I'm still
something
here,
to...
sorry.
Yeah.
I think, yeah, action is needed to bring EU policies in line with planetary boundaries. The increased emphasis on the climate change crisis provides a unique opportunity to address the neglect of the environment in the One Health discourse and explore the One Health approach for climate change mitigation. The climate crisis must be seen as the most essential EU health project that needs to be tackled holistically, for instance, viewed together with the socio-economic organization of society. In this context, it is time to radically rethink our ways of life. We need to harness new concepts that offer opportunities for transformation, such as, for example, considering economic degrowth in favor of health and environmental gains. In a nutshell, in favor of integrating the One Health concept into all EU policies. Political will must be followed by action. The clock is ticking. Thank you very much for listening.
Merci, Laura Roth de l'Université Technique.
Thank you, Laura Roth from the Technical University in Munich. Thank you, Babette. Can you summarize the recommendations by all those speakers within this working group?
To all speakers for their inspiring presentations. I think all gave strong recommendations how one could successfully translate need into action by a good recommendation, and also by taking underlying principles of global thinking, taking responsibility, and living solidarity. And let me briefly close table 1 with 3 comments. The summary of the recommendations are done later by Andrea Winkler. The first comment is also measures have been taken concerning the acute coronavirus pandemic. The problems go far beyond. We can only solve our global health challenges when we all put together our diverse strengths as European Health Union, tackling together these problems. And we would all benefit from each other's competence. Maybe we should sometimes have a little bit more courage and trust in the other person. We ought to take global responsibility for a healthy population on a healthy planet. And an important point, I think, that was also in the recommendations, we have to couple digital and green transformation to a transformation for health. This is the way to go. The second point I would like to make is to put a strong focus on prevention, not only in terms of pandemic, but far beyond. And it is very important to safeguard the health of all people without leaving one person behind. And the third point I would like to make is it is time to act. We have to speed up. It was already said. We had the young people here. It's their future. And we have to take our responsibility very seriously to preserve the future of the next generations, preserve their health and well-being. And of course, this needs leadership, strong leadership, And there is urgent need and time is running away. Thank you very much.